Well, that was certainly a treat, and now we're honored to hear from Senator Kelly Ayotte of New Hampshire. The senator has been a leader in the fight to stem the opioid epidemic. She is the author of the Heroin and Prescription Opioid Abuse Prevention, Education, and Enforcement Act, and she is a co-sponsor of other related legislation, including the very important Comprehensive Addiction and Recovery Act. She was New Hampshire's first female Attorney General and continues to be a very inspiring leader here in Congress. Please welcome Senator Ayotte.
I want to thank Mary so much for leading this effort and bringing us all together today. And thank my colleague, Ed Markey, who was just here before me, and also Senator Manchin, and also Senator Capito, who's going to follow me, because Ed was absolutely right. This is not a Republican issue. This is not a Democrat issue. This is not an independent issue, no matter how you affiliate yourself. This hits everyone. And this is a public health crisis that needs to be addressed in this country. In my home state of New Hampshire, I've done a ride-along with the Manchester Police Department, the largest police department in our state, and also the fire department. When I rode along with the fire department, within a half hour, we were responding to a heroin overdose. 2 weeks ago, when I was riding along with the police department, within an hour and a half, we had already gone to 2 heroin overdoses. And in the second one, I could barely breathe in that room because I thought no matter how much Narcan they gave that individual, that he was not coming back, folks. And then the families who have come to me and said, we lost a daughter, I lost a grandson, I lost my mother. This is hitting every single family. And why you're all here today, thank you, because we all have a part in this. We cannot arrest our way out of it. Yes, we can go after the high-level dealers. We can go after the interdiction over the border. Heroin's so cheap right now. But the medical community has to be a part of this because we know that opioids are being overprescribed. And we know that they're being misused, unfortunately. In fact, SAMHSA has said that 4 out of 5 heroin users reported non-medical use of prescription pain medication first. And so we know there's a direct relationship not only to those who become addicted to prescription opioids, but also the direct train to the heroin deaths that we're seeing. And heroin combined also with a deadly analgesic called fentanyl. That when the combination comes together, and we know that the drug dealers don't care how they mix this stuff up, people are dying. So what do we need to do? Let's all work together on this. I was proud to be an original co-sponsor of CARA. I know there's a CARA push. So your voices, there's a CARA push on the Hill this week. This CARA bill needs to get done, and it needs to get fully funded. And Ed's absolutely right. We need a national prevention campaign on this. You know, I look at what my kids think when they see smoking. I want them to understand the same when it comes about prescription drugs, when it comes to heroin, when it comes to understanding the challenges we face with substance abuse in this country. And also what I want them to understand is that the people who are in recovery, and I want to thank you very much, Mackenzie Phillips, for being such a prominent voice and coming forward and being here today, because what I want my children to understand is if you're in recovery, that you have courage, that we admire you, that it's no more stigma. What we want to do is get people help that are in recovery. So today, as you have this forum, we all have a part. We know that doctors have a part in this. They are here to heal people, but this isn't healing people. This is harming people. And so we have to engage the medical community in the best prescribing practices. That's part of CARA. We've been pushing that with the CDC. And I hope that when the CDC issues these guidelines at the beginning of the year, that they're talking to everyone. Because I think the FDA often is not talking to folks. and not really connected with what needs to happen. But we can't have that happen with the CDC here. These guidelines that are coming out and education for physicians and the pharmaceutical companies and addressing their role in all of this, because we all have a part in this. I want to thank you for what you're doing. Let's all work together. Let's take this into action, hit the hill, help us get care passed, number one, make sure it gets funded, and let's end this epidemic and support those who are struggling with addiction and say, we are there for you, we support you, we admire you if you are in recovery, because every family in this country is being impacted by this. So thank you for what you're doing today.